Obviously, we are all black men. I want to ask you all, how has your experience been being a black healthcare professional?
Man, so it's interesting for sure. I think you get a lot of especially like three of us, three black guys, we got locks. We don't necessarily fit the build of the traditional, dentist, but like we said, never seen it, right? So you definitely get perceived differently, right? So I think some patients are very curious and they're interested in your background, interested in your story and how you got to where you are and why you decided to go that route. And that, it makes sense. Sometimes we ask ourselves the same question, so it makes sense. But depending on where you are, some people are very like they take it to heart when they see a black man providing for them something they've never seen before, puts them in a different comfort zone where they're willing to tell you more things, or they're willing to kind of explain or open up a little bit more about their situation because they feel like maybe they can relate to you a little bit more. And then there's other people who see it as a barrier, right? Not only are you a black provider, but you're also young, especially coming right out of school.
For sure.
So you got to think you're what, 26? There's some people that were 23, 24, 25 coming out of dental school, some people 45, right? But you always get a little bit more, I guess, confidence when it looks like you at least have been there for a while, even if you haven't, right? So you have to go jump through that hurdle. Sometimes maybe they don't want to jump into the big procedure. They would want to do some cleanings and the fillings first before they really invest in, wanting to do something a little bit bigger with you. But I think it's been a great journey. Yeah, I've been able to learn a lot about myself, learn a lot about how to deal with patients, how to deal with patients that come across in a negative way
Mhm.
and kind of look down upon you because of what you look like maybe. And then other people who will celebrate you for being able to, have these type of accomplishments and have these type of reach these goals that we set out for ourselves. And when they hear your story and the things that you actually had to go through, that we all had to go through, it makes them appreciate the work that you give them that much more. And yeah, I think that's a really big part about just being a black provider, the experience of it. Um, I'm sure we'll continue to get better as we get into ownership and bigger deals and partnerships and things like that. But in terms of just pure clinician, I think it's been really solid.
For me, one thing I can say I can appreciate is the fact that I've had the opportunity to practice dentistry in so many different settings. I think, at least for the three of us, because we live here in Atlanta, Atlanta is not reality a lot of times. So, what I mean by that is, I've worked in Athens, Georgia, where I've seen a majority white population or patient base, and in those moments, I'll never forget. There was one time a patient came in, he and his wife. I already seen his wife. Granted, it was a Sunday. Like I said, a lot of times people don't work on Sundays, and this particular day I happened to be there by myself. And this is kind of how God works. The patient came in, he had two rotten teeth in his mouth, had an abscess, needed his teeth pulled. Once I walked in the room, I introduced myself, and he immediately stood up and said, "I'm not letting you put your black hands in my mouth." That comes with it.
Yeah.
So one thing I pride myself on is being able to get myself out of any situation. That's just something I feel like I'm very confident getting myself out of any situation. So although that was a shot at me, it was my first time hearing that. I was in my second year out of dental school, and he's saying this, and I'm just like, okay, so what's the problem with my black hands? Trying to make light of the situation because, granted, I'm from Mississippi. I've seen it all. His wife comes in and is just like, I'm so sorry the way he's acting like this, and I'm like, I understand. We'll kind of put a pause on it today, but in the event he wants to come after maybe about 2 hours or so, came back. The wife was like, "Hey, Doc, would you please give my husband another opportunity to be seen by you?" Absolutely. Took the teeth out. Thankfully, he wasn't in there that long. And on his way walking out, he was crying. It was just like, the fact that I've been raised this way to the point where, try to stay away from you people as much as possible. The fact that, you got me out of pain and there's nobody else here to help me unless I wait till tomorrow. And, the fact that I approached you in this way and you still took care of me, that meant the world. So just stuff like that, just like, reconfirms all of my upbringings and just the way that I carry myself. Because like I said, I may have the exact opposite situation here in Atlanta. I may see 20 black patients a day and it's like, oh, they see me always, then they kind of want to downplay the situation a little bit. It's like, I'm still a professional. I'm still here to help you. So I can see the best of both worlds there. But all in all, it can be difficult being a black provider. So like I said, we all got locks. We all men. Sometimes in dentistry, I learned this from Devontae. When I come in the room, I sit down. I want to meet you eye to eye. I lean back on the countertop or something like that. I'm meeting you eye to eye. Because unfortunately, society may paint us to be in a certain picture. For
sure.
But then once we get into that office, I am a human being, but I'm also here to help you.
Right.
Please get your feelings, put your feelings behind you, and allow me to do my job and allow me to help you, because that's what we came in for.
And even you saying, you made a point earlier where you were like, dentistry will really make you have tough skin, right? I think that, from the South, we've all been in certain situations where we've encountered certain things. But with dentistry, when our main objective is to help somebody and then these things come about, it's almost as if they are expecting us to act as if we're not professionals.
100%.
And that is the worst thing that we can do. And I know none of us will ever be out of character, because that's what we are. We are professionals. And it's unfortunate that these things do happen, but just as many bad situations or unfortunate situations I'm sure we've all been in, we've all had amazing situations on the other front, and if anything, I honestly don't think about it as much as I used to. When I first came out of school, I thought it would be a bigger hurdle, me being a black male, treating patients of all different races, said, they might think of XXX, whatever it may be. But what I've come to see is that I use it as an opportunity just to, bridge a gap. Because a lot of times, a lot of people might not this closely interact with African-American males, right? And so it gives us an opportunity to just show everybody, like, no, we're passionate about our jobs, we're professionals, and we're going to show up as such. But yeah, honestly, I feel like a lot of the mediator in a lot of this is pain, right? Like, if somebody's in pain, a lot of my patients will look at me and say,
They don't care who.
they don't care who. I'm looking like, can you do it? Please. Dr. Brown, please help me. And at that point, we establish a relationship, and
Pain is the equalizer.
that's
ain't
it.
it?
That's it. And so it feels great just knowing that that it's not as big of an issue as I expected it to be. Honestly, it actually has given me a really great outlook just on society. I think we have a lot of things going on in our world right now, in the U.S. especially. And I think that us just kind of being in the forefront of like really being able to help people and seeing these things and seeing how people really can be cool, I think it really helps me mentally and going through all the stuff that we go through. So, no, it's been cool. It's been good. It's been good.
Yeah. Likewise, man. I think, my name is Devontae Johnson. People know I'm black before they come in the door. You know what I'm saying? So it's kind of like, once I realized, like, you can't take it personal.
You can.
Because at the end of the day, you got to think like, man, you got to empathize with them. They done had so many traumas and different things like that. At one point, it was like, yo, I'm going to meet disrespect with disrespect, right? So somebody say, I hate the dentist. I would ask them what they do for a living. I said, what do you do for a living? Oh, I'm a mechanic. What if I came into your auto body shop and said, I hate mechanics? How would that make you feel from a first interaction? But then it came down to like realizing like what healthcare has become and what it is for so many people. I don't take it personal at all, right? You know what I mean? So I think that's one thing that you gotta kind of get exposed. I'm grateful that I worked in so many different settings.
Yeah.
And I've worked in these settings, like y'all saying, is like when somebody's in pain, they really don't care who can do it.
Yeah.
They just like, you can do it, you the guy that can do it, right? They just grateful.
Yeah.
So I think I've learned a lot from that. But the biggest thing that I'm grateful for is just being able to have the skill to perform, right? So when you get into these models and somebody finally says yes after being apprehensive and being able to perform at a high level, there's no better feeling than that. You know what I'm saying? Especially when you know you're capable, when you know you got the confidence, right? So that's why like clinical confidence post-grad is probably one of the most important skills to have outside of just knowing how to talk to people.
For sure.
Because once you get clinically confident, it comes down to saying, listen, man, I'm capable of doing it for you. if you're willing,
Yeah.
if it makes sense, I can take care of you. If you do not want to be, it's perfectly fine. I don't take it personal. You can move on. But knowing that you clinically confident, again, like you said, we don't even look at the schedule no more. It doesn't matter what's on the schedule, right? Because we done built that rapport. We built that skill set up to the point where we are able to be successful no matter what. So, nah, man, I'm grateful for the opportunity of like what I've been able to be exposed to. And I really don't feel like, again, you have these mental limitations that you think gonna happen, but after you kind of, have conquered those hurdles, it's not really a big deal.